Very, very long day.
Seaweed extract and rose. Gentle and quite light-handed approach. This encourages to clear tension and a little calendula. And then under the jawline into the neck with a nice hot cloth. And this is a lovely part of the treatment where therapist connects with client and letting the head rock backwards. The sides of the eyes, smoothing, reassuring. And then just gently applying pressure in between the brows. And the breath enjoys a deeper sensation. Hi guys, Victoria here. Welcome to Victoria's clinic, and you are going to see today a beautiful aromatherapy back, neck and shoulders with my beautiful friend Jodi. Jodi, yes, she's a good friend. She also runs a very successful clinic in our local town, and we regularly do swaps on each other, so I'm very lucky to know her. She is going to be arriving shortly, so first of all I'm going to get the room ready, which you'll see, and then I'm going to go outside, have a quick pre-chat with her. We're going to put on our PPE, and then I'm going to give her this lovely aromatherapy back, neck and shoulders. Stick to the end to see how she feels afterwards. Okay, see you soon. Having prepared the couch and warmed some towels, I'm now ready to welcome Jodi. Jodi, welcome. You've had a long day at the clinic.
Very, very long day.
Yeah, and you're looking forward to a nice aromatherapy massage.
I really need it. It's had a very busy week, so
okay.
I'm quite tense on my shoulders as well.
Okay, all right. Yeah, I'll look after you. So we're going to do a nice full body aromatherapy massage with a little facial at the end, and I'm going to check in with you occasionally, see how you are. And I look forward to giving you some nice essential oils. We're going to go in and work out which oils to give you.
Yeah.
So how are you? Anything you need to tell me?
I'm just, well, very tight on my shoulders, very tense I think, but it's just from all the hunching over and how I work, so I think I just need a nice release. Be nice.
Okay, I'll do my best.
I'm excited.
Oh good, excellent. Okay, see you soon. While Jodi washes her hands and applies her mask, I then prepare myself with my visor and my mask, then take her temperature before she enters, and I check her muscle tests called Kinesiology for tolerance of these essential oils. I've pre-chosen 3 essential oils, namely grapefruit, seaweed extract and rose. Each one beautiful for the skin in lots of different ways. Seaweed extract helps with skin conditioning. Grapefruit also helps with the skin, but also to relieve stress. And rose is beautiful for cell regeneration, reduce effects of aging, to minimise scarring for eczema and rosacea. Having removed one of the heated towels, I'm now applying some preheated sunflower and calendula carrier oil with the combined grapefruit, seaweed extract and rose essential oils, which are beautiful for skin conditioning, but also for treating with vitamins, because the sunflower carrier oil is just so beautiful for hydrating and nourishing the skin. This is going to be used on the whole body and to a certain extent a little on the face. So today, with the back, neck and shoulders treatment, I start off by just applying a good amount of this essential oil and carrier oil mix, and then I introduce my hands to the body, ask Jodi to take 3 nice long breaths, and with each breath I am separating my hands in order to lengthen the spine. This is so nice for the body on the couch to know how my hands feel, their warmth, the pressure that's going to be applied. It's a very good introduction. And now I start off with a figure of 8 massage, working around the scapula with my hands overlapping and mainly using my palms. So my palms are having a good feel of any tension in this area of the trapezius, the scapula, the deltoids, and I'm able to reassure, relax and relieve tension. And this is where the petrissage move of small circles always going upwards along each side of the spine and including the neck, which is the very top of the spine, of course, around the base of that occiput bone and the base of the scalp, and then upward pressure, but actually downward movement. So this is the trapezius, which is the muscle that goes from shoulder points to about the bra line in a triangle. And now I'm coming further down past the waist to the sacrum, and a beautiful flat hand effleurage circular move where you can see I'm encompassing the shoulders. So my palms are doing all the work here. The palms actually are the controller, and the fingers are just going where the palms are putting the pressure. Aromatherapy is actually a very gentle massage. The whole purpose is to get the essential oils onto the skin, which then absorb through the dermal layer and underneath into the blood circulation, and therefore transported all over the body. An aromatherapy massage, unlike a Swedish massage, will help in a very relaxing manner, where the person being treated does not have to consider any response or any unpredictability. It is simply a very relaxing, gentle and quite light-handed approach. Now I'm using my thumbs in another petrissage technique just around the edges and over the flat plateau of the sacrum. The sacrum is 5 of the lower vertebrae fused together to form a hard triangle. There's not much movement within the sacrum because they are fused together, and this means that toxins sit happily over that plateau for long periods unless they're agitated with massage, movement, stretching or yoga. And now a lovely technique where I'm overlapping my hands in order to encourage lymph and the circulation to move in an outward direction away from the spine, in between the ribs and out to the sides of the torso, where there will be lymph nodes waiting for any waste product within the lymph system, which could be things like uric and lactic acid, free radicals, and other waste products. You'll notice now on Jodi's back that there are some red marks. This is a condition called skin writing, which is also referred to as dermatographic urticaria. And fortunately, there is no pain. Sometimes with some people that get it quite badly, there may be some itching. In Jodi's case, there is no itching on this occasion. It's simply the redness there, which can be raised on occasion, but normally is just a little rosy. Apparently about 2 to 5% of us have skin writing. I'm doing this lovely overlapping hand move here in order to encourage the lymph away. And now I'm doing another lymph move, which is the scissoring technique, in order to agitate any of the lymph on very much the surface, just underneath that top dermal layer. And once I've agitated it with the scissoring technique, I then use my fingers in pretty much a straight line in order to push those lymph toxins away from the spine, via between the ribs and away to the lymph nodes on the edges. This has the effect of creating more flexibility, mobility, movement in the spine vertebra, the discs, and in the ribs. People having had this treatment often notice they're able to breathe more easily because the ribs aren't congested and restricted. They're able to expand more freely. Now coming round to Jodi's left hand side, doing the same scissoring technique along the length of the ribs. And now using my fingers in a long line to gently encourage the correct movement of lymph. This is so nice to receive. It's a very gentle technique. Most of the aromatherapy techniques are very gentle, and if you like, in the correct term of superficial, meaning they are on the surface of the skin, not necessarily going too deep, the way that Swedish massage would encourage with movements like petrissage and hacking and cupping. And now that lovely overlapping hand outward wave motion. Again, working quite lightly, because lymph always moves in a slow speed, always up the body, and lymph, because we're normally on our feet, or normally the right way up, then lymph is easy to go down, for instance, to pool at our ankles and our feet, our lower legs. But it doesn't particularly like going back up to the heart. So this is a nice move that encourages upward movement. And now you can see here a full effleurage technique, again including the whole shoulder points, and now a nice squeezing technique at the waist, which is the oblique muscles. So with this technique I'm using whole palms together, separated, coming down and putting the full amount of my thenar muscle and wrist into the waist area. Again, always encouraging muscle relaxation and movement of lymph in the right direction. What we're after as therapists is for the back to warm through nicely. So that it should go nice and rosy, it should feel warm to the touch. Even though the skin is exposed, the back should feel nice and warm. And now I'm doing a nice technique into the pelvis area. So this is working on the sacrum, but also on the pelvis bones, which are the iliac, and into the edges of that sacrum, where there is a joint called the sacroiliac, and this is held together by ligaments, which are, I always see them as like sellotape. So they're holding the pelvis together on the outside of the bones and also internally within the pelvic structure. Now coming up to the very top of the head, the back and the neck. This is a beautiful maneuver in order to encourage the nervine system, which is the nervous system. So we're talking about the cerebral spinal fluid, which travels down the dural tube along the line of the spine. It comes all the way down to the sacrum and goes up all around the spine to the brain and back down again. And what this does is it's communicating and stimulating the nervous system in order to encourage correct communication of the nervous system to the immune system. And when that happens, we are in a state called neurologically organized, which is a most beautiful state to be in, because that's when our body is at its healthiest. So having stimulated the points either side of each vertebra with each breath, I'm now overlapping thumbs in a slow downwards maneuver down to the sacrum. Again, encouraging the correct speed and movement of the nervous system, which is actually the cerebral spinal fluid. And now slowly coming back up to the neck to do the same procedure on Jodi's right side. So, having treated the spine, the lymph, the ribs, I'm now looking at the right side of the nervous system travelling down the right side of the spine, connecting either side of each vertebra as I travel down from the neck down through the thoracic area of the spine, down to the lower ribs, and then as I continue about now, I'm just at the upper lumbar area around the waist. This is the kidney area here, either side of the spine. And all of these acupressure points will be helping to set communication lines and meridians working well, channeling down the whole length of Jodi's body and connecting with each system in turn. Having stimulated those points again, I'm now going to overlap the thumbs in order to create the correct direction of movement down the side of the spine, which is the most relaxing, relieving feeling for the person receiving this. It is just so gentle, therapeutic, and above all, the person on the couch just feels like they are being cared for. There is an extension of care that feels so therapeutic and nurtured. Having finished that technique, I then come up again to do a lovely effleurage. This is the go-to technique between every long other technique used, whether it's petrissage or the spinal technique used in the nervous system just now. Jodi, having told me that her shoulders had been tense all week working in the beauty clinic, I'm now concentrating on her left scapula. First of all, just getting a feel for any tension there, where they may feel strained or stuck. Then using my thumbs again to create an upward relieving muscle movement on the trapezius, and then working on the scapula itself. Now this is quite a flat, hard bone, just like the sacrum at the base of the spine. And I'm using my thumbs, first of all, to have a feel if there are any amount of lactic or uric acid, which can feel like little crystals under the skin. And if it was under the scapula, then the shoulder blade would feel stuck, like there wasn't any flexibility or movement. And then I use my knuckles on that flat of bone. I'm not working it too hard like you would with Swedish massage. This is quite gentle but still incredibly relieving. And then overlaid hands to wash away any lymph and waste products that were agitated with the petrissage. Using my thumbs again on the mid trapezius as a connecting technique to come across to the right shoulder. And here I'm doing the same technique again. First of all, just sussing out exactly how the shoulder feels, where the tension may lie. And I'm using my overlaid whole hands again in order to feel and reassure Jodi that all is well. I'm creating warmth. It's very therapeutic. Once I've done that with my overlaid hands, I'm using my overlapping thumbs in a petrissage, always in contact with the body, with my fingers as well. Scooping up and working away any toxins that are making the shoulder tight or painful. This is so relieving, getting rid of tension and allowing the body to accept and let go. Always working upwards towards the shoulder point and the armpit and all down the side of the body, and indeed into the chest itself. There are many lymph nodes, and as I like to call it, in the chest and in the groin, there are lymph factories that will wait for all waste products in order to get rid and recycle. Now this is one of my favourite techniques. This is an overlaid hand working from the shoulder point in the deltoid across and up the side and back of the neck. This is working with the sternocleidomastoid muscles around the neck, the deltoids in the shoulder points, the very top of the trapezius, and it reassures, warms and relaxes in a lovely way of soothing, relieving, allowing the client to completely melt into the couch. I'm really quite low down over the body now in order to create the correct direction and whole hand effect overlapping on Jodi's left shoulder. Once I feel that the shoulders have relaxed enough, I'm now concentrating on the neck. And I've definitely still got my palms connected with the upper trapezius, my thumbs each side of the neck, but I'm now using my whole fingers and finger points into the neck and the acupressure points that are located in the base of the occiput bone, at the base of the cranials. And I'm not working too firmly. I don't want to make Jodi tense at all, but I'm making sure that I'm relieving and contacting. I like to be able to reassure my clients that there is nothing to worry about. They are able to trust me and relax. So having contacted the central occiput acupressure point, I've now got my index finger and thumb on the ones either side, and then to the fourth and fifth acupressure points in the saddle joint behind the ear with both thumbs. Stimulating and contacting that acupressure point, which is definitely in tune with the whole rest of the body. And now this is a lovely maneuver to warm through. The speed is slightly faster here. This means the client knows that we may be coming to the end of the treatment. The massage has concentrated on the whole back at times, and sometimes different parts, the scapula, the thoracics, the lumbar, the pelvic region and the sacrum. And now finishing off with exactly the same treatment that I started, which is the palm widening at the spine, lengthening, contacting the whole spine 3 times. Jodi and I are definitely in tune with the energy right now. Such a beautiful sensation in the room. Having warmed Jodi through, and just one last contact. This towel has been heating on the radiator, and now I'm going to ask Jodi how she feels. Okay, Jodi, how are you feeling?
Very relaxed. I think I nodded off at one point.
Oh, fine. I think I felt you jerk awake at one point. Yeah, when I was lower down.
The oils were lovely, nice smells.
Yeah, rose, grapefruit and seaweed extract.
Very nice.
I don't think I've ever put those together before. It just seemed to work for you.
Yeah.
So, how are your shoulders feeling after that? Because you said that they were quite
I can
tight.
feel you've worked them, definitely.
Yeah. Well, I will be doing a bit more on them when
Yeah.
you turn over. Okay, lovely. Hi guys, welcome back. I'm so excited to show you the next instalment of Jodi's Aromatherapy Massage. So last week you saw the back, neck and shoulders, and this week you're going to see the back of the legs, the feet and the front of the legs. This is a beautiful treatment and you're going to see the lovely aromatherapy oils with the aromatherapy massage, and stick to the end to see how Jodi feels after her legs have been massaged. Okay, see you soon. So, having revealed one leg, I now apply the aromatherapy and carrier oil very lightly to the back of the leg, and then slow down as I start the actual massage. You'll see there that I encompassed Jodi's right arm with the towel. That's to reassure that it won't fall off the couch if she wanted to allow her arm to lie further away from her body. And now giving a soft massage to the underside of the foot while she's turned over. Normally, I would actually treat the feet while she's lying on her back, but just while she's lying on her front is quite an easy, accessible way to reach the underside of the foot, using my knuckles on the pad and the heel and the in-between soft area in reflexology terms where the organs are contained, in order to help digestively, respiratory. Now starting the leg massage, introducing my hands and giving the leg a gentle tug in order to lengthen What this does is it stops a bunching up on the hip while she's lying on her front, so that the hip and abdomen can lie more aligned on the couch. And now working both of my thumbs together, one behind the other in a cross pattern, up the back of the calf. There are two larger muscles here called the soleus and gastrocnemius, and between them they have the same point at the foot, but they actually separate further up. So what I do with my thumbs is try and find a gap between them, about there, halfway up the calf, in order to clear toxins from the calf. Having worked on the Achilles, the back of the heel, I now raise the lower leg in order to get gravity to help me allow circulation of the lymph and blood back up to the knee. The knee contains a lymph node, which is actually the furthest point to the extremity. We don't have lymph nodes down by our ankle or foot. Now this is called 3-finger stroking, and you'll see they're quite flat fingers, so I'm tuning into very soft lymph which lies very close to the surface of the skin, and it's a very gentle stroking, then using 2 hands to gently tug on the underside of the sit bone, and that just confirms to the lymph in order to scoop away any toxins that I'm scooping up with the massage. So it's like a communication, really. That's the main reason for aromatherapy massage, which is to encourage the effect of the essential oils into the skin and into the body, but also to encourage movement of lymph. And now, working on the back of the left leg, I do exactly the same actions as I was doing on the right. So you'll see brief repetition here as I'm just showing you short sections in order not to repeat the full back of the leg for you. Again, this is working on the Achilles, overlapping with 2 thumbs. That can be quite a tense area, so I'm always mindful to be sensitive and caring. Again, working up that gap between the gastrocnemius and the soleus muscles. I don't apply pressure until about halfway up, about there. Just shifting it, encouraging it in the correct direction. And then the 3-finger stroking, nice flat hands, working always upwards towards the heart. And then once I've reached the top of the thigh, I'm just finding that sit bone at the bottom of the pelvis to just give it a little communication that all is well and to get on with its job of clearing lymph. A little contact with the back, which just tells Jodi that I've finished that part of the massage. Allow her to turn over sensitively, covered up. Always correct use of towels, giving the client reassurance that they're covered up. And I always have contact with the edge of the towel firmly into the body so that the client knows exactly where the edge of the towel lies without having to open their eyes and look. And now continuing with the front of the body. So doing the first leg here. Again, introduction of the essential oil to the skin, that beautiful grapefruit, seaweed extract, and rose essential oils. So now, having introduced the oil, I'm now focusing on the massage. This is a lovely strengthening and clearing technique where my thumbs at first are just feeling their way as to what I find. This is each side of the tibia and fibula, the shin bones. Quite often people have different effects each side. Some may be smooth if they're young bones and haven't had any breakages. Some might feel a little rougher with knobbles, as if there may have been injury or illness to that area. So I'm always sensitive to bring relief and clear any tension from around the shin. This is a beautiful technique, overlapping thumbs each side of the knee on that muscle each side, because the lymph node sits behind the knee. So I'm always encouraging the correct direction away from the joint towards the node. Now relieving tension around the bone itself. This is the patella that sits on the top of the knee. And you can see there, I encouraged a little movement left to right, and then over the top of the flat bone of the patella. This feels really nice to receive. And now working on the thigh. So this is overlapping hands on the adductor muscle. Now the adductor, of course, is one of the quadriceps muscles. We have 4 layers of muscle in the front of the thigh. The adductor on the inside, which helps us to bring our leg inwards. This overlapping action follows the movement that the lymph takes, but also the muscle. So I'm working in the same direction of the muscle in order to relieve tension and spasm. Now on the outside of the leg, I'm moving much more firmly here for an aromatherapy massage, encouraging lymph back up into the groin area called the inguinal lymph, up into the pelvis. Now some knuckling on the outside. As this muscle is a very strong muscle and quite often can feel tense and needs relief with a good massage and essential oils. Having covered the leg, I'm now working on mobility for the ankle and foot. Always supporting underneath the joint while I'm creating flexibility with the other hand. Working on the top of the foot, on the metatarsal bones, and now sitting down in order to see exactly what I'm working with the underside of the foot. The foot pad, in reflexology terms, contains the lungs. Now working on the lung right there and into the soft tissue, into the shoulders there, creating movement in a clockwise fashion on the solar plexus and down over the digestive, and then round the shoulder point, down the outside of the foot, over the joints, over the heel, and back up the spine on the inside edge of the foot to the neck, round into the head, so that's the glands and the brain, over the eye and respiratory centres, the sinuses, and down into the outside of the foot again. You see the foot does bend and rotate as I'm working on it. This encourages to clear tension. Our feet don't get enough relief and attention from us, so it's really nice to really focus on them occasionally. It's very relaxing to have your foot massaged, whether it's in a foot massage or reflexology, and again focusing on the solar plexus, just tuning in and helping with the energy levels after Jodi's busy day at the clinic. And continuing with some mobility. So first of all into the big toe, working on all of the joints. So that's the base of the big toe, which would be the neck, and then each of the joints working into the metatarsals of each toe individually. And the toes don't just have one joint, they have possibly two, depending on the length of the toe. You can see here I'm working not only on the base but also halfway up where there is a second joint. All of these joints are working for us all the time with our balance and movement. And finishing off with a beautiful flicking movement to encourage energy to dissipate that may have stored up in the feet, as it does store up in all of our extremities. A reassuring, overlapping upward massage up the ankle, and finishing by covering up, reassuring and connecting. Having revealed the right leg, I'm now going to copy similar moves that I created on the left side, and I'll be showing you these moves a little more briefly as they are repetitions from the other side. So having introduced those beautiful essential oils, I'm now working strongly up the front of the shin, feeling constantly as I go. So I'm always looking for any issues, congestion and tension. This feels nice to receive up each side of those shin bones, this time working with fingers instead of thumbs. Around the ankle, and now the knee, overlapping that beautiful muscle relieving feeling, getting rid of any tension around that strong muscle on the inside to the back of the knee, and now into the knee joint itself, around the patella, underneath it, to the sides, up into the muscle underneath. There are plenty of ligaments, tendons, obviously the bursas as well. A lot of action, and of course the lymph node that sits at the back of the knee. All of these areas need to be stimulated and relieved. Working in overlapping hands, firmly and sensitively in the same direction as the lymph and the muscle. On the inside of the thigh, over the top of the thigh, which is a nice strong set of muscles here. Slowing down to connect with the speed of the lymph, connecting with the whole leg again, and then back up into the thigh and out on the outer side again, where the abductor muscle sits. And the reason I bring the knee up slightly is to encourage the leg not to sit in a lock position. Working on the ankle again. Rotations, always supporting underneath. Not just supporting, but also feeling all the time, especially when I'm rotating with one hand, to check to see if there's any clicks and crunches within the joint while I'm rotating with the other hand. Working each side of those metatarsal bones up the edges of the foot, and now into each toe individually. Again, working each joint, so that was the lower and then the middle of those knuckles within the toes, the second and third, fourth toes, nice circles, and that lovely end joint there, relieving any tension, and then the little toe, massaging, rotating in both directions, and then working on those flick technique to bring out the tension, always connecting but relieving at the same time. And getting down to the level of the foot, always using thumbs. My thumbs are a way of finding out what tension there is as well as treating. It's a dual approach. Relieving tension within the lungs, solar plexus, digestion, and upwards. Spreading the upper ball to stretch it out. Our feet work so hard for us, and Jodi does spend long hours standing on her feet, so it's so nice to have this done. Finally connecting with the solar plexus point and covering up, ready to ask Jodi how she feels. So Jodi, just checking in with you. How are you feeling after your legs massage?
Very, very lovely. Thank you.
Yeah, all okay?
Yeah.
You still awake?
Yeah, just about.
Just about.
Yeah.
On and off.
On and off.
That's all
Drifting
right.
off.
Okay. So I'm going to be massaging your tummy and arms and shoulders now.
Okay.
All right. Okay.
Yeah.
Hi, Victoria here. So welcome back. You've now seen Jodi's back, neck and shoulders aromatherapy massage. You then saw the legs massage, and today you're going to be in the clinic with me as I massage the abdomen, the arms, hands and wrists, the top of the shoulders, across the clavicle, and also into the neck, and a nice neck release. So stick to the end to see how Jodi feels after that. Okay, thanks for joining. And as I apply the essential oil of grapefruit, seaweed extract and rose, the aromatherapy oils are mixed with a lovely organic sunflower oil and a little calendula. So the abdomen can be quite sensitive, so I always extend care here, being aware of the sensitivity of the nerves and the skin in the stomach area. So this is a very light effleurage without that feeling of being tickled. It's really essential to not induce any feeling of nervousness or sensation of too light a touch. An aromatherapy massage is generally a light touch anyway, so there is a fine line. And now I'm following the direction of the large colon, which is an upside down horseshoe from the lower left hand area, if we're looking at the abdomen in this fashion, up, across and down. Once I've used both hands in that direction, then use one hand a little bit more firmly, and now the two-hand overlapping directional massage, mainly using flat fingers and palms. So this is always in the same direction, going up, across and down, and as my hands travel over the lower abdomen, I reduce the weight of my hands so that they are very light indeed over the lower abdomen, where the reproductive organs and the bladder are found. The overlapping side gesture is so nice to receive because it's an upward, relieving those muscles of the obliques in the side of the abdominal cavity. This is beautiful as well to have done. Overlapping hands, and they actually come off, lift away from the abdomen. And the reason this is nice is where the upper central abdomen is the solar plexus, which contains a Chinese meridian point, which we refer to as the AP, the anxiety point. It is somewhere that can feel full of tension, and it is so nice to have that lifted, almost like our troubles and cares are being lifted away. And now I'm focusing on a few key meridian points. These are acupressure. And once I've focused on them 2 or 3 times in a sequence, I then do another couple of effleurage and then lift off very gently, always mindful of the sensitivity of the abdomen. And having replaced the warmed towels and the extra sheet over the top, giving Jodi some extra warmth for all the areas now massaged. So that's the legs, the abdomen and the hips. I'm now focusing on the arms. Having removed the edge of the towel, always sensitive to keep Jodi covered up in areas I'm not massaging, I first of all introduce the essential oils in a nice long effleurage, and then place one hand on the opposite shoulder while I use my flat palm to circle the elbow. In many people, the elbows can feel quite rough and full of tension, and so this circling is really nice to receive. I then focus on the bicep and tricep muscles, the front and back of the upper arm, before replacing the towel and using my thumbs on the forearm. Forearms are used greatly in life, and so this fairly firm massage, always applying pressure upwards towards the elbow where the lymph node is contained behind the elbow, then this helps the directional flow of lymph and circulation, also relieving any muscle tension and strain from the lower arm. And now, using a rotational movement, always supporting and holding at the joint, meanwhile rotating with the other hand. Now I'm using both thumbs symmetrically to work upwards in between the metatarsal bones of the hand, and now focusing on each digit individually and then each knuckle individually. Also a massage and a little pull. And the next finger, the index finger, massaging up and down, rotating one way and the other before supporting, rotating into the second joint, massage again. Now on to the middle finger, exactly the same again, massage, a rotation. Rotating both ways. I'm always looking for areas of tension or that might be catching. This is a feeling that might be produced from things like arthritis or repetitive strain injury, any issue in the hands from previous injury or breakages that I'm always looking for in order to bring more relief and get rid of tension. And a nice stretch on that finger, and then finally into the little finger, working into the joint at the base of the finger, and then the knuckle halfway up the little finger. Another massage, and a lovely palm massage where I insert my little fingers into the gaps of the hand between the thumb and index and the little finger and ring finger. Meanwhile, stretch open the palm and overlap my thumbs for a beautiful solar plexus massage. Up the hand, the wrist, finally into the forearm, and a gentle pull on the arm, and that relocates the shoulder onto the couch in order to lengthen and restore. And now working on the left arm, applying some of those beautiful essential oils that just smell divine. They'll be helping bring skin conditioning and stress relief, meanwhile helping relax and revitalize. First of all, some nice strong massage up the arm, always the strength going up to the heart. And then the same techniques from the other side, using my palm in a circling movement over that elbow. And down the bicep to the deltoid. And then into the tricep. Having replaced the upper arm and the towel to keep Jodi warm, I use my thumbs in this action on the forearm, and this creates the effect of Jodi's fingers, thumb and hand being stimulated and turning inwards as I push. This really shows me that she's relaxing into the movement and her forearm is benefiting. A nice circling of the whole hand into the wrist. Replacing the towels and then working my thumbs in a dual petrissage movement around the wrist, which has just been circled, and then up into those metatarsals. We can hold a lot of tension and lactic acid, uric acid and crystals in this area, so it's so beautiful to have massaged, relieved, rotated. I normally find, depending on handedness, that the fingers can hold a lot of tension and into the palm and into the thenar muscle of the hand. Generally, obviously, that will be most people's right hands, and sometimes I'll feel that into the left, depending on their way of working and how much they use their right or left hand. Now into those knuckles, a massage, a stretch and a little flick. The flicks, like I did on the toes in the previous video's massage of the legs, will help with dispersing energy that can be stored up in the extremities, therefore in the feet, the hands and the scalp and face. And now for that beautiful relieving massage up into the palm, which is the solar plexus point, into those bones of the wrist, always upward, overlapping and circling. Finishing off on the forearm and a gentle pull before replacing and covering up to keep warm under the towels. Here we are, now applying oil along the clavicle, under the neck and round the shoulders. I always make sure I've got enough oil that it feels ready for a massage without feeling that there's going to be too much friction, but not too much oil that it will feel greasy or like the oil might pool. So very gently touching over the clavicle bone, alternating one hand and then the other with a gentle neck pull. This is just my way of introducing my hands to this area that has not been touched or massaged in this treatment yet. Once I've introduced with the effleurage, I then use my knuckles in a beautiful, symmetrical technique, expanding, widening my hands away from each other. This really helps with the lungs, the respiratory system, and we make sure that we introduce a good amount of pressure there, and that will help us breathe more deeply. Quite often we breathe quite shallowly without realizing. So join me in taking a nice long breath right now. Now I'm using my fingers for a raindrop effect. Fingers together and then fingers separated. A beautiful tapping over the breastbone, the clavicle, around the shoulders, stimulating the lungs, stimulating the skin, finishing with a lovely effleurage and turning the head. I'm using one hand to support the head and the other to effleurage around the whole shoulder, and then using my knuckles for that lovely petrissage knuckling effect around the whole shoulder bone, the top of the femur, round the trapezius, the deltoid, into the neck muscle called the sternocleidomastoid. And you see, I'm using my thumb as a lever. This is my pivotal point. This is the area that supports me while my knuckles are rotating around the circle of Jodi's right shoulder. And then they come up in a lengthening maneuver up the neck to support, lengthen and stretch. This is beautiful on the back of the neck to relieve tension, to absolve any pain which could be causing muscle tightening and therefore constriction of blood vessels, which can lead to headaches and even migraines. And now I'm pushing down either side of the neck, using my thumb to clear the very front muscle of the neck without putting any pressure on the front of the throat. And doing the same on Jodi's right side, this time using both hands at first, around that shoulder, creating some space, moving the pillow, overlapping hands, just reassuring and allowing that muscle to relax. If there was any tension there where Jodi was supporting her own head, then this massage just wouldn't work. It would be too painful for her. So, having effleuraged, I'm using my knuckles into the deltoid, around the back of the trapezius, and up into the sternocleidomastoid. Again, using my thumb as my pivotal point. And I've always got my wrist supported on the pillow, so I'm not straining myself in any way. And now I'm using that thumb over the front of the muscle to clear the way of any toxins and tension that might be obstructing muscle action and respiratory flow. When I find an area of tension, I gently exert a little pressure onto that muscle. There might be a knot there, but I'd only do it once it's thoroughly warmed up and knowing that she's not using or tensing that muscle in any way. I now remove my chair and stand up in order to give Jodi a lovely lengthening neck release. I'm always supporting the head so that she gives her weight thoroughly, overlapping hands, and then support the head so that it relieves its weight backwards. This lengthens the whole spine, including the neck. And then replacing the towel, securing the warmth so that she knows that the towel is replaced right up to the neck. And then a few long effleurages from the breastbone, across the collarbone, over the shoulders, and up through the head and scalp, each time becoming lighter and lighter. A little contact on the head, closing my eyes, tuning into the energy, and then across the shoulders to let Jodi know the treatment is coming to an end. Hi Jodi, you alright?
Yes.
Yeah. So you've just had a whole body massage, including the neck up to the scalp, and I'm going to be giving you a facial next, so I'm going to ask you to get dressed and seated, ready for a nice Tropic facial.
Okay.
How are you feeling?
Very sleepy.
Yeah?
Yeah.
Are you feeling okay to get up?
Yeah.
Yeah. But your massage was alright?
Very nice.
Yeah. Any particular bits you preferred or?
Nice pressure everywhere, but the back of the legs was nice.
Okay. That's probably because you're on your legs, on your feet quite a lot at the clinic.
Yeah.
Excellent. Okay. So I look forward to giving you a facial now.
Thank you.
Hi guys, welcome back. I am Victoria and I'm going to be giving Jodi a beautiful facial today. I am using aromatherapy oils in the massage part, but I'm also going to be using a beautiful product called Tropic skincare. I'm going to be narrating over the top because of course I'm wearing PPE, so I'll explain everything I'm doing. You're going to hear some lovely music, and then I talk to Jodi at the end about how she feels, and obviously without a mask on because she's having a facial, you'll be able to see the effects of the products on her beautiful skin. Okay, so see you soon and thank you for subscribing. I'd like to introduce you to Tropic Skincare. This company is carbon neutral. It's an ethical brand. They include vegan products that are natural and freshly made in the UK. But more than all of that, they are wonderful products, beautiful on the skin, and I can't wait to show and share with you their delights. Here we have the smoothing cleanser, the vitamin toner, the Skin Feast moisturiser, the choice of masks. I'll be using the deep hydration mask and then a selection of serums. So I introduce my hands to Jodi's shoulders and neck, which have already been massaged, so there is already some beautiful essential oils on the skin. And I now hold back her hair with a hairband and show you the smoothing cleanser. As it says here, it's lovely not only for removing makeup, but also for refining, smoothing and cleansing the skin. I add a little water, warm water, to my hands, and then in upward gentle strokes I apply the cleanser to the face and neck. Working with warm hands, the cleanser is now being applied and working into the pores. This allows the pores to open, to be cleansed, ready for later on when I'll be helping the pores to close and remain clean. These upward strokes all help to lift the skin, lift the complexion, and relieve any muscle tension. Having applied a little more and some warm water, I'm now working into the neck, overlapping hand technique, alternating my hands while allowing her head to rest back against my body. This technique is always gentle. The whole purpose of this part of the technique is to allow the pores to open, to cleanse. So for each stage of a facial, there are different techniques used. For instance, now I'm simply using a very gentle little finger around the orbital bone, and this will help clean any remnants of makeup away, any dirt and pollution that we are exposed to. Jodi's been working indoors all day in a heated room, so there will always be some remnants of a tired and long working day, especially around the muscles of the eyes. And you'll notice that Jodi occasionally purses her lips together. This is a lovely gesture that she does, and it just shows that the smells and scents of the Tropic products that she can smell one after the other almost smell good enough to eat, as they do contain some essence of things we would have in our diets, like green tea, coffee extract, and fruits and essential oils. This is the organic bamboo cloth that comes free with every purchase of the smoothing cleanser. It feels so soft. I'm now using the clear slate, which is perfect for skin which has slightly larger pores. And there are 3 different exfoliators that I use with Tropic, and this, if you like, is the middle stage exfoliator. So there is one called Clear Skies, this is Clear Slate, and then there is one called Face Smooth. I'm working the lovely ingredients of Clear Slate into the pores, and especially up into any creases and any larger pores, for instance the temples, around the jawline, the chin, around the nose creases, up onto the top lip, around the smile lines, and up towards the ears. With all exfoliators, it's best not to use them within the orbital bone area of the eye. So I'm simply using it here on the rest of the face, avoiding the eye area and the lips. This product smells beautiful, and it's working its magic to gently exfoliate in a lovely foaming action. The good thing about this one is it doesn't strip the skin. If anything, it is giving back. All of the products are very respectful of skin. They never strip, and they always nurture. I've heated the bamboo cloth again with some fresh hot water, applying a little pressure around the nose, above the top lip, and into the jawline. Having refreshed the cloth, I now make sure that there are no remnants of the smoothing cleanser around the eyes, that the makeup is cleared away around the eyebrow, the eyelashes, and under the eye. I'm very gentle around this area. Less is more. And now for the massage. So this is a mixture of 3 essential oils that were decided on by Jodi and I at the start of the massage, and then I tested her muscle test with Kinesiology to check that those 3 were right for her today. And these are grapefruit essential oil, seaweed extract, and rose essential oils. And this time I'm using a symmetrical hand technique, using little fingers and sometimes whole hands in a massage. Now these techniques are multiple, having effleurage the whole neck and face. I'm now using my little fingers in an outward petrissage technique from the line by the nose to vertical lines in a sweeping maneuver outwards towards the ears. And there were 3 lines going from under the eye down to the lower cheekbones, the zygomatics. Now effleurage over the forehead, and again a ring finger massage, petrissage again, symmetrical from the center outwards to the temples. We hold a lot of stress and strain in the muscles and nerves of our foreheads, over the frontal bone. So it's so nice to literally have those washed away, have those massaged and relieved. It greatly helps us with things like headaches, eye strain, frown lines and wrinkles. And now very slow orbital massage with a nice acupressure touch to the temples and then upwards over the forehead. There are many acupressure points on the face, around the scalp and neck, and I'm using a few of those here in order to tune into the Chinese meridians, in order to encourage and stimulate the body to self-heal. Again, acupressure over the cheekbones and then over the jaw. And in order to bring Jodi's head into a still point, I'm pressing very gently on the jaw tip and above the top lip in 2 very important Chinese meridian acupressure points, and then massaging them out so that they are relieved. This is the rocking horse technique, using fingers each side of her lips up to the temples, out to the forehead and out again, rocking between the 2. Having done the facial and neck massage, I'm now reapplying a little smoothing cleanser in order to clean away the massage oil ready for a mask. So I'm pressing gently into the orbital sockets, into the cheeks, and then under the jawline into the neck with a nice hot cloth. Padding any areas that I feel needed a little drying. So this is a deep hydration face mask. It's really thick, it smells amazing. Deep hydration contains some beautiful ingredients, including rose resurrection flower extract, wild Australian riberries, and pepper berries to create a cooling, creamy gel mask that soothes dry and irritated skin. This can feel quite cooling to the skin when it is first applied. I'm using a beautiful silicone spatula, as the whole range is vegan. Normally at this stage, spatulas would include animal hairs or fur, and this one is beautifully crafted so that it is smooth, it glides and retains the coolness of the mask. Personally, I like to apply quite a thick layer of mask, and this helps to create the feeling on the skin that it is being cared for, covered correctly with no paler patches, and that I am not saving the mask for future use, but I am being generous and luxuriant with the mask. There are so many nerve endings and tiny muscles contained in the face that we are very aware, even with our eyes closed, maybe even more so with our eyes closed, of what is happening to our face while we're having a treatment. Our nerves are very stimulated and aware of any action and pressure. So Jodi at this stage will feel everywhere that there is mask, everywhere that feels like it has less. For instance, there is no mask covering the eyes and the lips. And now I make the most of having a few minutes rest with the facial in order to remove the hairband and give Jodi a beautiful, relaxing scalp massage. I'm using my massage skills to bring further peace and harmony to the whole head area, working my thumbs upwards on the sides of the scalp, having introduced my hands with a whole hand effleurage. Now my fingers symmetrically work each side of the head, working up and down the scalp to stimulate and therefore relax. Because quite often The muscles need to be reminded to relax, reminded to let go, because without that encouragement, they simply stay in spasm and strained. And furthermore, it's even better to have a massage from someone else rather than treating your own scalp, because the unpredictability of the techniques that someone else is using will further enhance the relaxation, volume, if you like, into the scalp. This is working with double thumbs over the center acupressure line, following a middle parting line. Having stimulated, I then draw a line to clear those acupressure key points. And again, working incredibly gently with all of my fingers upwards in gentle circles. And while I'm resting Jodi's head back against me, I'm very gently stretching and drawing the hair away from the top of the head, and then connecting with an effleurage from the top down the neck over the arms. You can see Jodi here is incredibly peaceful. I often think that most clients will be seeing colours at this stage behind their closed eyelids. And having finished with the whole head to the arm effleurage, I tie up the hair and have a little look at the face to see if it's ready for me to remove the mask. First of all, reapply the hairband and heat the organic bamboo cloth ready for removing the mask. The mask does really smell delicious, and when it's warmed with the cloth, it boosts the scent from the mask, and it really does smell quite creamy and tasty. Jodi's skin is now looking so soothed and hydrated. This mask can be also worn overnight, taken off in the morning, in order to give your skin a freshly hydrated and masked face all day long. Using more hot cloth with fresh hot water, I'm clearing the mask from the areas of the face before continuing with this lovely vitamin toner. This contains cucumber extract, aloe vera, and plenty of vitamins. And then the Skin Feast moisturizer comes in a pump bottle, a couple of pumps each time, applied gently in a pattering effect to the neck and the whole face. I'm still avoiding the eyes, but I will be treating the eyes later. Once I've applied using a pattering effect, I then return to the alternate overlapping hands coming up the neck very gently. that lovely de-stressing move across the jawline, over any dry areas that are normally here for cheeks and nose, the forehead. This really helps with any head congestion, mentally or physically. And now Super Greens. This is my favourite. It's a serum which is oil based, so it's applied after the moisturising cream. It smells delicious. It contains kale extract and plenty of vitamins to help soothe and boost the nutrients of the skin. The chlorophyll and maca root extract and green coffee and tamanu oils. They all make this one my favourite product. It smells so beautifully spicy. When applying, it really feels like you're giving vitamins directly to your face. Always upwards. This seals in the facial. And finally, treating those beautiful eyes with Eye Dream. This can be used at night or in the day. It's a thickish cream. I only use a tiny little bit for around the eyes. I warm it first and then apply with my little finger very gently. This is just around the orbital bone, never going deeper into the eye, as the eye skin will absorb what it needs from the cream around the orbital bone. When I apply this at night, if I feel my eyes in the morning, I feel that the cream has been absorbed into the whole eye area, even though I've only applied it to the orbital bone. It's such a beautiful cream. It has a bluey colour to it. There is a set of creams which also include a day cream with a beautiful Zamat tip, so it's cooling as it applies, and also some under eye masks which again are gel and cooling, and they come in a set. Tropic products are just so well thought out. And now just a little contact to the temples, closing my eyes to tune into Jodi's energy, the relaxation that we have achieved between us. A final contact to the shoulders, removing the hairband, loosening the hair. And now a little chat. Okay, Jodi, you have just had a full body massage and a facial. How are you feeling?
Unreal. Brand new woman.
Yeah?
Yeah.
And you've had quite a stressful week.
Very stressful. I feel completely, it's a good end to the week.
Well,
I can relax tomorrow now.
I must admit to you, I was very nervous giving the facial queen a facial.
No, it was lovely.
I got through it.
Yeah.
Okay.
I relaxed.
Oh, good. Okay. So, what was your favourite part of the treatment?
The back massage was lovely, and the facial, my skin feels lovely and glowy.
Yeah.
I love the face mask and the super greens that we put on at the end.
The serum.
Yeah.
Yeah. Good. Yeah, that's my favourite.
The smell of that is really nice.
Yeah. Yeah. It's lovely and spicy.
Yeah.
Sort of green and spicy.
Yeah.
So, are you all right to go home and drive?
Yeah.
And you're okay?
I'll have the windows down.
Okay. Lots of water.
Yeah.
Okay. Well, thank you very much for coming.
Thank you.
Okay. Bye, guys. Okay. Hi, Jodi.
Hello.
Hi. You're back again.
Yeah, back again.
So
Every month.
Every month, yes. And I come to you every month.
Yeah.
It's so nice. This time you're going to have a full body aromatherapy massage.
Yeah.
And a hoppy ear candling. And you've had aromatherapy massage with me before that was filmed and went out, and it's been very popular.
Well. Yeah.
You like your massages, don't you?
I love a massage. I like the core in between, but every so often I like a massage.
Yeah, yeah. And of course, you give massages every day?
Yeah.
Yeah, most days?
Yeah.
And you're probably giving a massage thinking, I could really do with this.
That should be me.
Yeah, good. Okay, well, I look forward to giving you both treatments.
I'm excited.
Okay, I'm just going to raise the couch up a little. So you've had quite a busy day, Jodes, yeah? So I'm just wondering what essential oils to give you in your aromatherapy massage. Are you driving a long way after this?
No, not.
You're not? Ah, good. You doing much tonight? No. Nice. So can I go for it? Yeah. Okay. So I'm going to select a few that I'm thinking of for you, knowing your medical history and things, and I'm going to put them on you and then just test your kinesiology, see if those are the best ones for you today. I'm not going to tell you what they are at first. I'll tell you after I've tested you. Okay, so first of all, can I just reveal a hand? Lovely. You can bring it back here, or just onto the towel. Is that comfortable like that? And then just bring your thumb to your little finger. I'm going to try and pull apart, and you're going to hold together and hold really strong. So I'm going to go for it, and I'm putting all 4 of the ones I'm thinking of on you, and then we're going to test you again and see if your body likes these. And hold. Yeah. Got it right first time. That's great. Okay, so you can release your fingers and put them back under the warm in the towel. So we have got frankincense, geranium, ylang ylang, and rose absolute. So they are beautiful oils. You may know that geranium is particularly good for hormonal balancing. Roses as well, but it's also like having a hug from your grandma. It's like a really coming home kind of feeling.
I love rose.
Oh, do you? That's a good job. I should have asked you if you like those oils. Do you like them all?
I do, and geranium.
Oh, lovely. Yeah, so rose being a base note is quite a thick, slow oil. I'm just waiting for it to come out of the bottle. Here it comes. And then ylang ylang is also a base. In fact, we've got 3 bases and 1 middle note here. Oh yeah, that came a bit faster. Then frankincense. So frankincense really lovely for the skin, for any agitation, really soothes you after a busy day. Opening a new bottle of geranium. Oh yeah, a few drops of that going in there. Of course, being a whole body massage, there's quite a lot of oil there. This is a organic sunflower carrier oil that I've got. Yeah, it looks nice. Okay, so I'm just going to remove the top towel, put it on the radiator for later. I'm going to tuck you in. Lovely, so you're completely covered there. Getting a good amount of warmed aromatherapy oil, pouring it onto the back. sure everywhere is covered. Including the neck, very top of the shoulders, into the hips and the sides of the torso. Are you warm enough, Jodi?
Yes, lovely.
Oh, good. You've got the heated couch on. Okay, so 3 nice long breaths. Lovely. Lengthening the spine. Just coming round, massaging from the top, using whole hands. So I can remember the last massage we gave that was filmed, we talked about the skin writing. And I can tell immediately, normally, a couple of years ago, this would now be lined and red, and there are no marks whatsoever. So good. So
I think it's almost gone, really, after 7 years.
7 years. So do you think we just grow out of it?
I think it's either 7 years, 3 months, or for life. That's what it says online.
7 years and 3 months.
Or 3 months, or for life.
Oh, I see. Gosh, very precise amounts of time. Yeah, looking really good. So I'm just feeling into those shoulders, seeing what they're telling me. Using quite a strong, double-handed approach. And then bringing warmth and a strength either side of the spine over the area at the top of the thoracics, which tends to bulk up with a certain type of action when we're leaning over, using our body weight forwards. We want to make sure that that soft tissue there, all of that fascia, is, if you like, agitated, so that it removes its tendency to bulk up. We don't want congestion, stagnation. We want a lovely, fluid, smooth muscle. Sometimes they just need to be encouraged to lengthen and get rid of any spasm and tension. Coming over with double thumbs over the top of the shoulders. And then around the scapula, drawing a line, using the edges of the finger tops and finger sides to come around that left scapula. And then while holding the bottom of the wing of that scapula, the pointed lower section, using the other hand in a soft knuckling action, generally pressure going upwards so it comes up over the shoulder and down to the cervical lymph factory in the front of the chest. So this is where it's quite nice for the body to respond with a rosy colour. We want the body to go rosy because then we know that the blood is getting through correctly, that there's no blockage. And where there's blood, as the Chinese say, there is qi, there is life. So it's really good if it goes nice and rosy. And then finishing off that left scapula with some strong flat hand overlapping over the top arches, moving any toxins that have been agitated to go upwards, up and over, and to be eliminated in the waist. Coming round to the other shoulder, starting off with that, drawing a line around the top, the sides, even the arm side of the scapula. So it's like a wing, it's like an angel's wing. And sometimes these scapula, being flat plates of bone, just like the sacrum, can get stuck and fastened underneath if they're not moved in every direction that they can move. Then they tend to stagnate and stop being able to move in all of those lovely directions. And this type of massage is a lovely way of getting that flexibility, mobility working again, so that the scapula has its full range of movement. And then holding the bottom and knuckling around. How's this feeling, Jodi?
Good.
Yeah?
Yeah.
It can be a bit sore over that area, but it is okay. Of course, you use your shoulders all the time, don't you, with your work? Yeah. They should feel a lot better after this. Then a reverse effleurage, pushing the hips strongly up the sides, over the shoulder tops, supporting the neck, and lightly down to the hips, around, strongly up. So just coming round to the side of the spine, using 2 thumbs with the breath just to activate in between each vertebra those lovely nerve endings, allowing the communication to harmonize between the lymph and the nervous system. And this is a lovely part of the treatment where therapist connects with client, harmonizes breathing one to the other, and also feels that beautiful expansion that naturally happens with every breath. Where every cell in our body expands as we inhale and contracts as we exhale. And this is a technique that needs patience, plenty of time given to it. Because a lot of the feeling behind this technique is actually energetic. There is a physicality to it where you feel the breath moving, but also as a therapist you get a sense of what's going on in the body, especially each section. So when I'm at the top, I'm feeling into the shoulders and the neck, but also into the face, the head, the cranium, what might be going on in the mind, mentally. Allowing these nerve signals to help soothe and relax. And once both are stimulated, we then clear each side in that beautiful channel that is thumb-sized. Each side of the bones of the spine and inside the length of the muscle called the erector spinae. I once had a massage from a lovely young girl many years ago who actually massaged very strongly the erector spinae, either side of my spine, in a overlapping thumb petrissage motion going upwards towards the neck, and it was very painful. And I know that, bless her, I think she was meant to be working here in that lovely little gully in between the bone and the muscle, which then helps that muscle as well. Just there. So that's the correct place to do it, either side of the spine, but not too far away from it. Now feeling into the trapezius. That's nice and warm. Yeah. Smells amazing. Can you smell it?
Yeah, it's lovely.
Oh, ylang ylang, frankincense, rose and geranium. Amazing. I think I'm going to be asleep as well. Okay, so beautiful upward effleurage over the trapezius, the lat dorsi, and the beautiful hips into the waist, strongly bringing those toxins up, moving the fascia, soothing and elongating the muscles. Now working on the hips a little. Working into the iliac bone, using 4 fingers in a circular petrissage, anchoring with the thumbs. Coming up more centrally, each side of the sacrum, bringing in the knuckles, tracing the edge of the sacrum bones, and then on to the top of that beautiful triangle, pushing down towards the heart. And then one of my favourite moves, coming up, splitting strongly around the waist, the obliques, down to the couch, and gently up. Down, round, and up. One more time. Now for a scissoring action you'll have seen me do before, which helps agitate the toxins within the lymph system, as there are so many lymph nodes on the side of the torso. So just working on Jodi's left side at the moment, scissoring the fascia in between long fingers, And the lymph tends to sit on the very outer side, the superficial side of the body, very outer. And so we work quite gently when we're working with lymph. So I'm now bringing down in a lovely long line of fingertips to the very outer edge of the torso where the lymph nodes sit. Lymph tends to work very slowly. That's why a massage is so good, because it doesn't have a heartbeat to move it around the body like the red blood cells do. So that's why things like putting our feet up, massage and exercise all help to stimulate the lymph, to get it working, to go back uphill, up to the upper torso, where there are two large lymph factories in the torso that will then help eliminate any waste products. Just gently agitating the very surface. Making a line and smoothing out slowly to the armpit, where there is a very important lymph node. I want to get those moving. And over. Lovely. Coming back to lovely home ground, the effleurage. Up strongly, warming and securing, supporting. Up strongly, around the tops of the shoulders, edge of the torso. Including the arms. And now working, overlapping, wave-like motion coming up the body. Again, working on that lymph. As aromatherapy massage, that's its main intent, working on expelling any waste products, moving the lymph, helping the body work again once it hasn't got all of those crystals, lactic acids, free radicals, any waste products that do not serve us. Overlapping, warming, reassuring. This particular technique, it can feel like there's more than one person working on the body. I know from personal experience, when I have a massage, I like it to feel almost unpredictable. That I don't know what's going to happen next. I can't second guess it. And giving the neck some attention, coming round, Softening that trapezius up into the side of the neck muscle, the sternocleidomastoid, up over that deltoid. And pulling the corner, the V of that angle there over, bringing any strain and tension away. Coming round the other side. Repeating the move, bringing the hand over. Whole hands overlapping strongly up the leg, over the Achilles, gently over the back of the knee, strongly up the calf and the hamstring to the side of the hip, and then bending the knee and checking out the calf, making sure it's not in spasm or any knots. It's quite a strong calf. I can feel there's a little bit of tension there, but I'm using my thenar in the base of the hand. halfway down the calf to just help expand that V area as the calf splits higher up. So it's together at the start here and then it splits. It can be a little bit sensitive. And then massaging both sides and gently down, supporting the foot. Over the Achilles, using thenars again to rock the Achilles side to side and strongly upwards with thumbs splaying the calf again, now that the calf can relax on the couch. Gently over the popliteal, and then 3 finger stroking, overlapping with flat fingers, medium pressure up the back of the leg, especially over the hamstring. And just hooking under the iliac, round and down. Smoothing and reassuring. Pouring the oil over the whole surface area of the sole, the toes, the heel, Achilles, back of the leg, up to the hip. Pressing the foot into the cushion of the couch, up and round. Applying the oil, introducing my hands and allowing the muscles to feel the contact so that they know the strength, the type of movement being used. And then bending the knee again. And strongly coming down the calf, using fingers, but mainly the base of the hand, just to feel what's going on in the muscle. This one feels not as bad as the left. The left was a bit tense. This one isn't smarting. And then coming down, resting the foot, working into the Achilles, rocking it back and forth, side to side. And then double thumbs up and gently pulling the leg, lengthening, helping to stretch out that hip, the femur locking into the hip at the top. One more time. And then 3 finger stroking. Gently over the popliteal of the knee, strongly up the hamstring. Lock under the bone, round the side of the hip and down, pressing the toes, the top top of the foot into the soft cushion of the couch. Okay, Jodi, when you're ready, you can turn over. You're covered. It does, doesn't it? Right, I'm just going to put the insert into the top of the couch. And some tissue. Okay, shall I take your bobble out? Okay. That comfy? Yeah, yeah. So having effleuraged the whole right leg, now coming up over the top of the foot, not too strongly to put too much strain on the ankle, over the ankle and then up the shin, overlapping whole hands. And I like to just trace the edge of the bones here, checking them out, feeling for any blockage or injury, any scar tissue, any congestion, and then smoothing that out, encouraging them upwards towards the back of the knee, over the knee softly, whole hands, tracing the edge of the lovely patella, and gently rocking it side to side and up and down. Lovely patella. And then shifting any waste materials back, encouraging them to the back of the knee and on the other side. And now a lovely move. This feels fantastic to receive. Overlapping alternate hands, tracing the way that the muscles fall as they come from the outside
to the inside in this fashion. So I'm working up, following those muscles up towards the outside hip, bringing that lovely inner thigh, encouraging it up, round and over, bending it just like we do in core therapy with tweener, with bending the muscles, encouraging some give and softness. And then over the top of the muscle, the 4 quadriceps, and then the outside coming up to the very side of the thigh, right up to the hip. Fantastic. And now the lovely foot, circling, rotating in one direction. Over the ankle bone, over the top of the foot. And gently massaging 2 toes, little and large, rotating them round, a few crunches and a gentle tug. Same again, the 2nd and 4th toes, massaging, encouraging them in circles and a little tug. To the underside. Great, stretching. Working on the reflex points. So this is the spine. The neck, the lung, shoulder, down, elbow, hip, knee, the abdomen, solar plexus. Introducing the oil to the front of the left leg, making sure there's plenty. Gentle tug to stretch out the leg from the hip, reassuring the foot. Overlapping hands strongly. And then checking out the bones, the fibula and tibia. Lovely soft tissue around the sides and back of those bones, clearing any toxins which can feel a little bit sore. And then tracing a line in the front of that very strong tibia. Lovely. Right up to the knee, gently over the top of the knee of the patella. And then tracing lines around the patella. Smoothing around and then pushing back to the lymph node behind the knee. And this side, lovely. And then a beautiful move of overlapping alternate hands, picking up and gently pulling over the quadriceps in that lovely angled technique, coming up towards the outside hip. Strongly up the front and the side, the whole side of the leg up to the hip. Picking up the lower leg, just turning the ankle in one direction and the other. Round the ankle, over the top of the foot. Oh, lovely. And massaging the big toe and the little toe together. A few clicks and crunches. Massaging second and fourth toes, rotating and a gentle tug. Lovely. Two-finger overlapping circles. Stretching out the sole of the foot at the lungs, solar plexus, the abdomen. Coming down the spine, stretching out into the neck, lung, thyroid, shoulder, a nice pull. Introducing the oil to the abdomen and just gently introducing my hands, allowing a very soft effleurage technique to spread the oil and allow my hands to connect with the beautiful abdomen. Just feeling into the soft tissue under the ribs between the iliac now working a little firmer, working on the abdominal organs. A lovely tummy rumble shows two things. Shows Jodi's really relaxed. So it's definitely a compliment to a therapist when the tummy rumbles. But also it shows that the treatment's already working, that the abdomen is relaxing, that the organs are letting go and allowing beautiful process to happen. Coming over the colon and back down. Softly over the lower part, strongly up, across and down, up, across and down, coming up and round, coming together. And now, the takeoff, the wonderful feeling of spiritual connectedness. Down, around, and together. Connecting with liver and stomach, ovaries to a Chinese meridian called Ren and back up. Using plenty of oil so that there's no tug or pull to the skin, making sure every part of the arm, hand, shoulder, wrist is moisturized and covered, ready for a lovely massage. Bringing the hand to the opposite shoulder, securing, and using the palm to rotate around the elbow bone. And down, making sure the upper arm is vertical so that any toxins are more easily pushed back to the auxiliary lymph node. And down the outside of the arm really strongly. Really nice there. And then supporting back down. And using two thumbs with the elbow secured to the couch, which tends to pull on the tendons, curling the fingers. From the wrist, 3 or 4 stages down to the elbow. Lovely. And around the wrist, a few clicks. Each side. And into the hand. Each digit individually, massaging sides, top, bottom, rotating, and a gentle pull. Making sure every knuckle is covered and massaged. Even these little knuckles, the ends of the fingers, the mid knuckle and the primary knuckle. And then turning the hand to reveal the palm, overlapping thumbs, one and then the other, as it pulls the tendons, curling the fingers in, and then over the center base of the hand, up the arm, towards the elbow, to encourage the lymph node to continue removing waste products. Bending at the elbow, securing the hand to the opposite shoulder, making sure the upper arm is vertical, and then smoothing down from elbow to shoulder tip, over the top, the side, and the underarm. Rotating the palm over the elbow bone. And then 2 fingers down strongly in 3 or 4 installments, all the way down to the elbow. Round. A nice stretch. Around the wrist. And to the top of the hand. Through the metacarpals, rotating each finger and thumb over the thenar, over the nail. A few clicks. And a gentle stretch. Turning and clearing the solar plexus in the palm, reassuring, massaging that contentment area, that feel-good factor. All is well. Introducing the oil, making sure there's plenty so that the skin feels moisturized and hydrated, but also so that the massage uses the aromatherapy essential oils to good effect, where the oils will go through the skin into the blood circulation and help regulate and harmonize all of the systems of the body that those 4 oils help with. They help with sleep and endocrine regulation. They help with stress and with tense muscles. Using the knuckles now over the area already effleuraged, describing a circle around the shoulder point. And coming up into the soft tissue between the shoulder and the neck, at the trapezius and the sternocleidomastoid muscle supporting the head and neck. Gently around the length, coming up, round, down, finding the edge of that muscle, securing and reassuring it, allowing it to lengthen and relax. Stretching over just gently under the occiput, very top of the neck, just palpating into the lovely space between the occiput and the vertebrae. Some key meridian acupressure points. First a little massage, and then a little activation. Stretching, supporting, pulling it over. Nice long whole neck stretch and back. Ready for the other side, coming over. Stretching the shoulder away, massaging with a whole hand around shoulder to the shoulder point, around the back of the soft tissue. Tracing fingers down the muscle at the side of the neck, coming down, down, in order to encourage toxins back to the cervical lymph in the chest. Over that shoulder point and using knuckles again. Lovely. Stretch down and over. Oh, fantastic. Wonderful stretch. And now a little neck stretch. Fingers into the base underneath the occiput and tilting the head back naturally in order to create space. and a gentle pull before coming up. And letting the head rock backwards before gently stretching, repeating the same, coming up, using the fingers to massage upwards either side of the spine, either side of the neck, allowing the weight of the head to tip backwards. And lengthen.
Jodi.
Hello.
Hi. You're back again.
Yeah, back again.
So
every month.
Every month, yes. And I come to you every month.
Yeah.
It's so nice.
So
Really look
nice.
forward to it.
Yeah.
This time you're going to have a full body aromatherapy massage
Yeah.
and a hoppy ear candling. And you've had aromatherapy massage with me before that was filmed and went out,
Yeah.
and it's been very
It did
popular.
well. Yeah.
You like your massages, don't you?
I love a massage. I like the core in between, but every so often I like a massage.
Yeah, yeah. And of course, you give massages every day.
Yeah.
Yeah,
every day.
most days.
Yeah.
And you're probably giving a massage thinking, I could really do with
that
this.
should be me.
Yeah. You're having a hoppy as well. Is there any particular reason for that?
Because I'm flying soon. I find it really helps if I have one just before.
Mm-hmm.
With
Pressure.
the pressure, yeah, and then you don't get the pain when you're landing.
Yeah, lovely. Good. Okay. Well, I look forward to giving you both
Yeah, I'm
treatments.
excited.
So, hoppy ear candling. You mentioned about plane travel and it helps with pressure in the ears when you're landing. So, do you generally have any issues with your ears or only on landing?
They do get blocked sometimes. But yeah, you usually just notice them when I'm landing.
Okay, and do you have any issues with hearing or balance or dizziness?
I don't think so.
And would you say that one of your ears is worse than another, or are they about the same?
My left one is usually worse.
Worse. So that means we're going to do that one second. So if you want to turn onto your left, and I'll cover you with some towels, would you like that? And keep warm. And then we'll treat your right ear first. Your tummy's going. It could be mine as well. I've given you hoppy before, so you may remember. I've got an otoscope that I'm going to use and just check the ear before and after, if that's okay. Yeah. So if you want to turn onto your left, on your side, and bring the pillow into, that's it, if you lie down, into there. Perfect. So it's supporting the neck and the head. Does that feel comfy? Then I'll get the towels. Now what I tend to do is put a pillow in between your knees as well. Would you like that? Yeah. Okay. Like that. Is that about the right place? Right, how's that?
It's comfy.
Oh, good. Now, I'm probably going to ask you, have you got a hand here?
Yeah.
To put your hand here, push the pillow down, because then I'm going to need you to turn your... Perfect. So that the ear hole is actually uppermost. Are you comfy like that?
Yeah.
You just take your hair away, otherwise that's going to annoy you. There we are. Just going to look in your ear first. Okay, it doesn't look too bad. And then just gently pulling your earlobe to allow the correct fitting of the end of the hoppy ear candle to the outside of the ear. It's not entering the ear at all, it's just sealing around the very outside. I'm just supporting it here, and I'll be watching it the whole time. Meanwhile, giving you a nice little sinus massage across the face, the chin, around the lymph nodes of the ears and around the back of the head. These are all key places that can be congested. For instance, the sinus membranes behind the frontal bone in the forehead, and the sinus in the cheeks, the lymph across the jawline, and many acupressure meridian points as well. Having stimulated with a few light pressures in a very gentle action. Oh, lovely, I'm hearing some crackling sounds now. That's a good sign, shows the candle's working already. And of course, the candle is a bit of a misnomer. It's not really a candle because it's not solid wax and it has no wick. It's more like a chimney, which is hollow on the inside, and the fire in this case is at the top of the chimney and therefore draws in a very gentle action from below up through the chimney and out of the top. So how a hoppy ear candle tends to work is the warming action of the flame, which creates a smoke that comes down the chimney and out of the top. And as the flame warms, it warms inside the ear as well, in a very reassuring, calming way. And there are essential oils in with the linen and cotton made in the chimney of chamomile, and that chamomile has an anti-inflammatory action. So any inflammation in or around the ear, into the sinus membranes and all of the respiratory areas connected with the ear, will be calmed with an anti-inflammatory action. I can hear a lot of rain outside on the bothy roof, and it's very nice being in here in the dry and the warm, all cosy and secure, enjoying a lovely treatment. And the good thing about hoppy ear candles is, because they're not made of paper, because they're made of fabric with a woven texture to them, the grey ash at the top is not like paper or wood ash at all. It stays intact, and if it does bend, it tends to bend over and not break. And of course, we're always keeping an eye on it, making sure it's behaving and nothing's going to happen. So now, in long lines, just using a caterpillar action from the top of the neck through the acupressure points of the occiput and then over the base of the scalp, helping to clear and at the same time activate and stimulate those meridian points, which will all help with the respiratory system, any ear blockage, and induce a feeling of calm and relaxation. As the candle slowly burns down, I'm going to let it burn down a little bit nearer to the red line. Before removing it and immersing the rest of the candle in some cold water to help extinguish the flame. I find that this area above the ear on the scalp is particularly good for removing any congestion in the ear, working on the soft tissue of the scalp into the hairline. Working on the temporal bone into the temples, sides of the eyes, smoothing, reassuring. Gently turning the candle to break the seal, bringing it away. Very carefully, just cleaning the very outer side of the ear into the very top, into the crevices all the parts of the ear that help us listen and hear everything we need to. And then the very outer side of the whole of the ear, just to clean it. I'm just going to have another little look. Yeah, great, that looks better. Super. Okay, so I'm going to remove a towel and this one. I'll remove the pillow. You can turn over. Are you okay?
Yeah.
I'm glad you're not driving far.
I know. I don't think I could.
And the towel's going back on. You okay?
Mm-hmm.
Perfect. So I'm just going to check this ear. Okay. Yeah, maybe it is slightly more waxy than the other. So just going to light the candle. Very carefully, just touch it to the outside of the ear, give it a little turn, make sure it's sealed, pulling the earlobe. Lovely, securing it in place and keeping an eye on it. Stimulating the correct direction for movement in the forehead with these lovely lines of gentle pressures using the pad of my finger. Oh, lovely, some noises have started. That's what we want. We want little fireworks. Little fizzing and popping noises. Sometimes it can be more than that. Oh yeah, I can hear them now. That's a good sign, shows the candle's working. into the side of the nose and gently, small pressures outwards in a line, and the pressure is also angled slightly outwards. Oh yeah, some lovely fizzing noises. That's really good. And then over the chin, just gently at the acupressure point under the lower lip, massaging and stimulating, and then gently pinching along the jawline in an outward action. What tends to happen with ears that are more blocked than others is they take longer to burn down because the airflow is not as smooth, it's a little bit more congested. Just feeling like this area needs a little bit more attention. Right in the centre, under the occiput. Just clearing away, just going to give it a little bit of Qigong energy. And then onward pressures up the back of the scalp using 3 fingers in order to maximize the beneficial effect of clearing meridians and acupressure points and all of those nerve endings and lymph nodes, as there are many around the ears and in the head. Coming to work above the ear. it's really crackling. That's great news. It almost sounds like waves coming into the shore, healing, bringing us harmony, and just turning slightly in order to break the seal, bring it over. Just going to give the very outer part of the ear a little clean in case any smoke residue from the candle. And the very outer part of the ear, not going inside at all, just the entrance. Just going to have a look with the otoscope. Oh, lovely. I think you'll see a difference. That looks much better. Okay, gently, gently take a couple of deep breaths slowly come back round into the room very gently. Lovely, have a little stretch, move your body, breathe deeply. So you've been fully massaged, hoppy ear candling, and now you're probably ready for bed.
Definitely. I don't think I could move from here.
Okay, well you've got plenty of time, so I'm going to get you a glass of water. And thank you for coming today, Jodi.
Thank you.
And I'll see you again.
Thank you very much.
My pleasure.
Hello.
Give me a hug, darling. I'm just going to have a little look in your ear and then just gently helping to balance and taking 3 nice long breaths. Jodi,
Hello.
Give me a hug, darling. You good?
Yeah, I'm good, thanks. How are you?
I'm really well. And I'm looking forward to giving you a double treatment today. Yeah, so we're doing hoppy ear candling and Reiki.
Yeah.
I thought we might do the hoppy first.
Yeah,
and then just chill for the Reiki.
Yeah. I haven't had Reiki for ages.
Have you had it with me?
Yeah.
Yeah, okay.
Once, I think. Yeah, but a long time ago.
Right, okay.
Yeah.
And I'm quite excited because I haven't done this for any of my clients before, but during the Reiki, like towards the start, I'm going to be introducing a few sound chimes,
Okay, nice.
which are a little bit ASMR-y, so
Yeah.
that's sort of
Yeah, I love
tinkly,
that.
tingly feeling.
Yeah.
And then I might give you a little bit of guidance with the Reiki, but there'll be a lot of silence as well, just to completely chill and go into your own space.
That sounds nice.
So with the hoppy, is there a reason you wanted hoppy?
My ears are a little bit blocked at the moment, I think. They just get a little bit itchy sometimes.
Yeah.
So yeah, they're quite bad at the moment, actually. It's good timing.
Okay, so there's no issue with balance or hearing?
No.
Okay.
Don't think so.
Are you just about to take a flight anywhere? Are you doing it because of flight?
Unfortunately
No. Okay.
No flying, but I always do have one when I fly, but they're just quite bad at the moment.
Okay, all right, we'll do that and it should improve.
Yeah.
But before we start, I've got out my virtual reality cards
Yeah, I
here.
love these.
Oh, bless you. If you would like to delve and have a tune into one.
Resourceful. I find ways to release hidden potential, giving heart to others that solutions can always be found.
Ah, I think you are.
Yeah.
Obviously, being a business owner, you have to find solutions all the time.
Yeah,
don't you?
true.
Aren't there problems every day?
Yeah, many.
Not problems.
Yeah.
Challenges and opportunities.
Yeah. That's a good one, actually, isn't it?
Yeah. Do you relate to that?
Yeah, I think so. Definitely.
Good.
Definitely with work, yeah.
Put it on my windowsill. We've had some good ones this week. My client, just in case viewers are watching actually, because I treated lovely Sky yesterday and I forgot to do the virtual reality card before her treatment, but afterwards, that wasn't filmed, she picked Magical. Could you read that for me? Because I've got my glasses on.
Oh, God.
Well, on my head.
Simply by believing in possibilities, I turn loss into benefit, the ordinary into extraordinary.
Yeah, and she's hopefully Sky's watching this, but she's
Yeah.
a really confident, vibrant
Oh,
young lady
really?
about your age.
Yeah.
And bless her, she travelled quite a long way to see me.
Yeah.
And she'd found me on YouTube. And she's a singer. So she brings that vibrant energy to a lot of people's lives, including children and weddings and all sorts.
Okay.
So yeah, she was
That's
really
a good one
lovely
for her.
to treat.
Yeah.
Yeah, magical.
Magical.
Yeah. So I'm going to put these away and then give you a lovely hoppy treatment.
Thank you. I love the ones that you do that with the cupping on the face, the ASMR ones. The cupping is so good, you know.
With these.
Yeah.
Have I given you that? I have, haven't
Yeah,
I?
I've had that.
I have
But
given
on
it to
the
you.
videos, that sounds so good.
Oh yeah, that.
Oh, I love. Yeah.
And then the little diddy.
Yeah.
So I treat myself to facial cupping twice a week. I do it on Mondays and Fridays, and then I know, I'm getting it done twice a week. And I do my décolleté and my neck, my jawline.
That's why you look so young, isn't it?
Oh, keep telling me, Jo. Just keep telling me. And obviously, lines and the whole face really. But those cups can be used anywhere on the body. And I don't know if I've shown you before, but there's this one as well.
Oh yeah.
Which is, I've been using it quite a lot recently on backs and necks, and like down the whole shoulder, from the neck and down the shoulder, over the trapezius and deltoid. It really helps with a massage, and it feels nice. It's not quite as strong as the fire cupping, it's still cupping, and it gets the blood there, it goes all nice and red, but it's a little bit softer than fire cupping.
So you don't have the marks as much?
Funny you should say that.
Yeah,
but I treated Jez, who everyone knows, my hubby Jez, yesterday, to a bit of a neck release and shoulder like massage, but also the core therapy neck release, and I used that cup. And didn't notice at the time, used the cup. And then this morning I said, oh, you've got a cup mark on your back. So it is possible, but maybe I just did it a little bit too strongly on him, thinking, oh, he can do it. It's only Jez. I'll just go straight in. Yeah. No wonder he was complaining. Okay, so Hoppy, if you had an ear that's worse than another, which one would it be?
This one.
Okay, straight away you knew that.
Yeah.
So I'm going to treat the better ear first. So if you would like to turn on to your right hand side.
Yeah.
I'm going to give you a thicker cushion.
Okay. Oh, thank you.
So I'd like you to put this into the crook of your neck like that. Is your hair in the way? Yeah? Lovely. Is that comfy?
Yeah.
Would you like another pillow between your knees?
Yes, please.
And then bend your knees so that you're not rolling. Is that all right?
Yeah.
Yeah?
Yeah.
And I'm just going to look in your ear with an otoscope, if that's okay. Just tie my hair back. Your first ear hole's a little bit dry, isn't it? Do you treat it with anything?
No, I never take my earrings out really. I think that's why.
And are they gold, your earrings? Yeah. And you got a little bit of a reaction to it. Have you ever noticed that? Yeah.
No.
So you don't know if you have on the other side? I'll check.
Yeah, have a look.
Not the second piercing, but funnily enough, the first
the original
piercing.
one.
Yeah, it looks like it's had a bit of a reaction.
Really?
Yeah. Unless...
It doesn't feel itchy or anything.
Actually, your earrings are a size, aren't they? They're not just a little stud.
Yeah.
So maybe you haven't noticed it because there's quite a size that you wouldn't see behind. I think occasionally it just needs taking out.
Do you think?
Properly cleansing like you cleanse your face and moisturising. That's probably all it needs.
Yeah, just a bit of hydration.
Okay, just turn your head a little bit so your nose is down. That's it. Perfect. As long as you're comfy like that. I'm just going to have a little look in your ear. It looks fairly clear. Yeah, not worried about that.
I'm just going to put 1 drop of rose essential oil in the palm of my hand. Rose is a bass note, so it comes out nice and slowly. It's taking its time. That's a beautiful colour. And then also 1 drop of petitgrain essential oil. Smells amazing. So this is orange blossom. So we've got 2 flowers here. Lovely. I'm just going to hold them in front of you just to let you breathe in deeply. So, having lit the hoppy, which is more of a chimney than a candle because it is hollow all the way down, made up of linen, cotton and beeswax. And then just going to place the candle just inside, just using the lobe to make sure the candle is sealed just in the very outside of the ear, making sure you can breathe okay. And then while the candle is in, I'm going to be keeping a good eye on the flame because that tells me a lot about the health of the ear and inside, including the sinus membranes and all the channels in the respiratory system connected to the ear. Obviously the mouth, and down to the lungs, the eyes. So now just very gently using my little finger pad to tune into how the sinuses are feeling, whether there's any tightness or restriction. The candle's burning nicely at the moment. It's just a very gentle flame, but it's a nice constant flame. It's not irregular at the moment. There are tiny little crackles. They may get more as the candle burns down. And there's a nice little gradual squeaking noise coming from the top. It's very low. Ooh, little crackles. And then just very gently supporting, like a gentle pinch around the brow line, warming and softening the sinus passage just under this area. Being slightly stronger here under the cheekbone, the zygomatic arch. And constantly listening for the reaction of the candle with each pressure. Because sometimes a particular action can create more of a reaction to the candle. And what I tend to do is come back to that particular spot, give it a little more pressure or more time. And then the jawline. We've got some lovely noises happening now. So, hoppy ear candling is an ancient therapy and is used today for an array of issues, not just respiratory. So I've used hoppy in the past with children and adults for attention at school, for headaches, for insomnia, for neuralgia to the face, for tinnitus, vertigo, for Meniere's, and for relaxation, which can help with depression and anxiety. Because there may well be blockage to the respiratory system, to the sinuses, which can cause headaches, to the ear, therefore hearing, which can cause lack of attention, not being able to hear in class. And sometimes children will actually play up in school simply because they don't realise it, but they can't hear as well as the other children. So I've helped children with that issue and they've greatly improved in class. And of course the candle is made of linen and cotton, not paper, and so the ash is intact and won't fall down. It's simply one long piece of fabric. Obviously we pay attention, and if there was a breeze, an open window and a wind through the room, then it might blow off, but normally stays intact. And then just treating around the glandular system to the throat and the back of the neck. Feeling into the acupressure points of the occiput. A little bit tight just behind the ear. So actually the main line and the second one feel not too bad, but then the one just behind the ear, key acupressure point, is quite tight here. Just giving it some attention there. Lovely, it's softening already. And then we take the candle out just at about that point, about a centimetre above the red line. So I'm just cleaning the very outside into the ear lobe, checking, cleaning out any debris, either from the candle or from the ear itself. Then I'll just have another little look with the otoscope. Lovely, even better. You can see that it's had the effect of those essential oils and beeswax. Okay, so nice and gently, if you would like to turn over Jodi onto your other side. Comfy. Didn't ask, do you want a cover on you?
Yes, please.
It has been warming, even though it's
Perfect.
been a warm day today here. How's it been at work?
Yeah, it's actually been hot as well.
Yeah.
It's quite stuffy today, isn't it?
Okay.
Yeah.
I'll just have a little look in your ear first. Okay, so yeah, you're right, there is some wax and debris, but it's actually quite near the surface.
Really?
Yeah, there is a blockage there, but I think this will make a difference. So by holding my finger underneath the candle before applying it to the ear, it creates that downward calling for the smoke and the vacuum, and that helps the chimney effect of bringing that gentle pressure out and upwards out of the candle. Okay, so applying some pressures again. Quite often one ear can be quite different from the other. We'll see what happens. There's a nice gentle flame at the moment. And then just gently applying pressure in between the brows, under the brow line, raising, if you like, the burden of the eyebrow shelf, an area that can produce headaches and stress. And then just pinching gently across that brow, creating warmth and softness. And then under the eye, in long lines, encouraging outward flow through and away from the sinuses, clearing the whole respiratory system. Feels a bit tight there. Just going to give it another couple of seconds in that place. So the candle is burning nice and evenly. It's staying tall, and just coming round to the glandular system, feeling for those acupressure points again, comparing to the other side. And I particularly like checking and clearing the glandular area up and around the ear and behind, where the hair doesn't grow. There is a lovely area that's very sensitive to touch, and it feels very relaxing and soothing to have this area massaged in this manner. And then just tuning into that acupressure point again. That was a good sound. A little crackly firework. And twisting to come out. Jodi. Oh
my God.
Can you see without glasses on?
Wow. That was blocking it, wasn't it?
And the other end.
No wonder it was itchy. That's good.
But also, I think when you shower,
Yeah.
if you can take your first piercings out, don't just
think,
use
yeah.
your a gentle cleanser from your face on the earlobe, but also into the ear as well.
Yeah. Okay.
Behind's okay, but I think in the lobe needs cleansing occasionally.
Okay.
Yeah. Right, I'm just going to have another look with the otoscope.
It could be where the shampoo dries, isn't it?
It could be, yeah. Okay, so the little bit of wax that I said was there is still there.
Oh, okay.
So I think it may well come out over the next couple of days.
Yeah.
That's what can happen with hoppy ear candling.
Yeah.
It just gets it soft and shifted, so you might feel it come out or notice it on the pillow, or you might not notice it.
Okay.
Okay, so if you would like to lie on your back, I'm just going to give you just a 10-minute scalp massage to finish off. Comfy?
Yeah.
I'll bring your hair out, that's it. Oh yes, they are. I thought there might be.
Thank you.
And just gently start stretching through the body, fingers and toes, moving into shoulders if you feel like it. Breathing deeply, and if you want to, just extend the arms and have a nice long body stretch. You feel okay?
Yeah, thank you. That was nice.
Good. Your ears feel nice?
Yeah, they do actually.
Yeah, good. So I'm going to go straight into a Reiki for you now. So you don't need to move.
Good.
You can stay exactly as you are. I'll just bring the pillow down a bit further. I'm quite excited because I haven't done this for any of my clients. A few sound chimes. Okay, so take 3 nice long breaths, and the energy that surrounds you, that is felt in years gone by, all the way to the foot, but abundantly down to the crown. And then sealing the energy.
The bright white one in the corner of this eye here.
Yes. Okay. That's really good. Jodi,
Hello.
welcome. Give me a hug, darling. You good?
Yeah, I'm good, thanks. How are you?
I'm really well. And I'm looking forward to giving you a double treatment today. Yeah, so we're doing hoppy ear candling and Reiki.
Yeah.
I thought we might do the hoppy first.
Yeah,
and then just chill for the Reiki.
Yeah. I haven't had Reiki for ages.
Have you had it with me?
Yeah.
Yeah, okay.
Once, I think. Yeah, but a long time ago.
Right, okay.
Yeah.
And I'm quite excited because I haven't done this for any of my clients before, but during the Reiki, like towards the start, I'm going to be introducing a few sound chimes.
Okay, nice.
Which are a little bit ASMR-y, so that's sort of
Yeah, I love that.
tingly feeling.
Yeah.
And then I might give you a little bit of guidance with the Reiki, but there'll be a lot of silence as well, just to completely chill and go into your own space.
That sounds nice.
Okay, so take 3 nice long breaths. And just inhale the essential oils of rose and petitgrain, flowers that will help you relax and send you to a beautiful place. I'm just tuning into the energy of the room, my energy, and the energy that surrounds you. Immediately, it has activated. I can feel like a dynamism, a power. Just feeling into the white light that comes down to the top of your head. It's quite a thick, vibrant white light. I can feel it's quite tangible and palpable today. It has an amazing abundance to it. And this is your energy. This is yours to own and use. Amazing feeling. So at the moment, simply tuning into white light. And there may well be a feeling of the light in the presence of a feeling that touches the crown of the head, down the sides of the face, across the shoulders, down the arms, maybe even into the palms. And it may be felt like a tingling sensation. And the white light continues down the throat, across the chest, and down the torso, down the back and spine. And it is felt in every cell, deeply into the body, and continues around the hips, down the legs, knees, shins and calves, ankles, feet and soles, all the way to the toes. White light now covering, embodying and fulfilling the whole body. It is felt like a gentleness, and yet very present. It's okay. Feeling into Reiki at an emotional level. Feelings, emotions, happiness, and colours may come behind closed eyelids. It may be felt to the sides of the head. into the throat, into the ears. There may be a warmth and a softening, creating a flow of gentle energy. Now introducing some beautiful chimes. These are the chimes of fire and air. These are the chimes of earth and water. and all of the energies of the earth, the air, water and fire are now balanced and creating harmony within and around the body. Feeling a wonderful tranquility in the organs of the heart, kidneys, liver, spleen, lungs, and also to the brain. A wonderful tranquility. Where the organs and brain instigate a feeling of relaxation, deeply, deeply letting go, becoming heavy and succumbing to a profound healing Reiki. Tuning into distant Reiki that is felt in years gone by, in present times, and in future years. It is also felt wherever you may be at any time. That you can tune into this sense of Reiki and healing whenever you want to. Just tuning into the Vishuddhi chakra, the chakra of the throat, of blueness, the blue colour, of water, freedom, breath. And the breath enjoys a deeper sensation where the conscious level is able to succumb and the unconscious wealth of availability opens up during Reiki to reveal so much more consciousness. There is a wealth of deeper meaning oneself that is available in this subconsciousness. Opening the throat to freedom. And tuning into the heart chakra at Anahata, feeling the heart open, become warm, receptive, able to receive love and to give. Giving more and more power to the Reiki where it's needed. Feeling the warmth, massaging the aura. And now down to Manipura, the solar plexus chakra. Which is feeling open and just starting to warm. Quite often there'll be chakras that need a little extra attention in order that all 7 are balanced, working together in harmony. And of course, the solar plexus is an abundant sunshine yellow. That's better. Tuning into that feeling of coming home, feeling blessed within oneself, content just to be. Feeling into sacral chakra, bright orange around the hips and lower abdomen. connect with the hips to give the area a little warmth. Linking, connecting with the sacral chakra. Connecting with the inner child of laughter and fun, smiles, spontaneity, allowing the body to feel that contact. The inner child is reaching out, telling you it's all okay. They're guiding you, holding your hand as if it's yourself at an early age. Wrapping a warm, woolly, orange scarf around the hips and abdomen to help connect the inner child and that sense of frivolity, gregariousness and fun. And connecting now to the base chakra, Muladhara, also called the root chakra, because it's found at our root, at the base of the torso, underneath us. It's the source of life, the source of our energy, the source of how we started. Beautiful red energy of fire, warmth, determination, resilience and strength. Beautiful. Massaging into the chakra, warming, giving it some tweener. Just gently touching near the base, tuning into the source of life. Now just touching into the legs, feeling where the energy is coming down the legs from the torso, extending the harmony and balance that Reiki gives us. bringing the energy further down the body, down the right side. Really feeling that warmth and energy as it comes down all the way through the shin and calf. Holding the soles of the feet, calling the energy all the way down from the top of the head to the soles of the feet, the whole body and all of its aura is bathed in the most glorious light. Colours may be seen behind closed eyelids. There may be a sense of a white light and then merging within the white light. There may be several separated colours, perhaps of magenta, of indigo and purple, of blue, green, yellow, orange and red. From the ankle of the shin and calf to the left knee, there is felt a tingling vibration of a profound energy making its way from the body all the way to the foot. Healing as it travels, creating harmony and balance. And then from the knee to the thigh and the hip. So that the whole body is now doused with the most beautiful white light. The heat being created with the Reiki is quite strong under my hands. The leg feeling particularly warm. Quite hot. Coming back up to the chakras, tuning into again the root chakra, red energy of survival, strength. It's feeling good. Feeling into that sacral chakra once again. Svadhisthana. Bright orange. Wonderful. Harmonizing. Connecting with that beautiful little girl, the inner child. Hello. Now, once again at Manipura, yellow solar plexus, deeply connecting to a sense of joy, a sense of self. Just at that upper abdomen area, above the navel. Sometimes the area can feel quite tight and constrained, but at the moment it feels soft. At the moment it feels soft and calm. And into Anahata chakra, the beautiful green energy that is felt deep within us in the chest. Much love. And now back to Vishuddhi, throat chakra, a blue energy of freedom. Feeling that cooling movement of breath as the inhale goes down through the throat, and the warmed energy as the exhale comes out past the throat and out of the nostrils, clearing, cooling and warming. Beautiful feeling there. There's quite a lot of energy here. It's quite high. And back to third eye chakra, the ajna, just in the forehead, deep within and in front. It can be seen as a purple or indigo colour, connecting us with our intuition, our clairvoyance, our mentality, and that sense of knowing that we just know things deep in our consciousness. Really strong pull, like a magnetizing sensation coming down to the ajna. Just feel a need to put a crystal to the ajna. It might feel a little cool. Amethyst rested on ajna. That's really helped, helping to calm the mind, coming back to a deeper level of consciousness. Affirming to oneself, I am calm and relaxed. I am calm and relaxed. I am calm and relaxed. And back to Sahasrara, the crown chakra. Tuning into the white light that is abundantly coming down in a gentle manner, but abundantly down to the crown, around the body and through. Amazing energy, really tingling. Now coming back to the root chakra for the last time to tune in. Make sure all is well before I semi-close the door to the chakra. That's good. Now to the sacral chakra, feeling what the energy is telling me. It's all good. It's a lot calmer. It's in tune and in harmony. Giving it a final boost of energy and half closing. Now to the solar plexus chakra, Manipura. Oh, it's lovely. Very happy. Yellow energy. Up to Anahata. Much love to Vishuddhi. Tuning in, feeling that warmth again, equalizing the energy, balancing. That's good. That's good. And back to Ajna, third eye, purple light. All is well. I am calm and relaxed. And Sahasrara. The energy is quite big here. There's a lot of energy moving. Gorgeous white light, it's palpable. Just helping to balance, finalize. Calming, calming. That's good. And then sealing the energy, holding the energy in underneath. Above, to the sides, below and on top. All is held, ready for a beautiful rest of the week. I'm eternally grateful to the Reiki guides and angels. Thank you for the energy. Thank you to the universe, to Mother Earth. Keeping your eyes closed and taking 3 nice long breaths. And slowly sending your breath to your feet and your fingers, and gently moving, stretching through the fingers and the feet, and then turning into the ankles and the wrists, maybe into the shoulders. And moving into the body, and if you feel like it, bringing your arms up over your head for a whole body stretch. Opening your eyes if you feel like it, maybe not. I'll just move the stone. Oh, that's warm. How are you feeling?
Very chilled.
Yeah. Did you have any sensations during the Reiki?
No, I definitely switched off. When you were talking about the light here, I did see the white light there.
Oh.
The bright white one in the corner
Yes.
of this eye here.
Yes. Okay. That's really good.
But yeah, I did switch off, definitely.
I think you probably needed to. I could feel quite a lot of activity
Yeah.
at particular places. So, your third eye here, which of course is the brain as well, it's our thinking, was quite busy, understandably, but it really calmed, and what really helped was the crystal.
Oh, yeah, I did feel a difference when you put that on.
Yeah.
Yeah.
It was like pressing a button, just like a dimmer switch.
Yeah, it was good.
The brain. And I just felt this need. It was like you were telling me, I think I need something there. Yeah. And when I was talking about connecting with the inner child, were you aware at that point?
I don't think so.
No. Okay. No. That's good. That's all right, because in that case I was talking to your subconsciousness.
I was definitely switched off then.
Lovely. You're making little movements, and I think you do that when you've switched off.
Yeah.
It's good. It's a compliment. So do you feel ready? Are you driving a long way now?
Yeah.
Okay. Are you feeling okay to drive?
Yeah, I feel good.
Yeah.
Yeah.
You feel ready to move?
Yeah.
Okay.
Thank you.
My pleasure. I'll just take the cover off. Would you like a glass of water?
Yes, please.
Yeah.
Oh. My socks.
I'm sorry.